While their name suggests that Maltese dogs are from Malta, most people believe they were originally from South-Central Europe. Maltese are a toy dog breed. They are hypoallergenic dogs with white hair. Maltese were most likely bred from Spitz-type dogs. However, there is not a lot of written history about the origin of these dogs, so their past history is not completely clear. While it is not believed that Maltese dogs are actually from the island of Malta, a lot of past writings about them indicate that numerous individuals from the ancient Greeks to the physician for Queen Elizabeth I believed that they were indeed from Malta. Maltese dogs are a toy-size dog breed. Both males and females are around the same size. They stand between 7 and 9 inches tall and weigh less than 7 pounds. Since this is such a small dog breed, the puppies are very small. They can weigh as little as 1/4 pound at birth. By 3 months, puppies typically weigh between 2 and 4 pounds. By the time they are 6 months old, most puppies will be close to full grown. Being aware of some of the common health issues that these dogs may face can help you be prepared to provide the best level of care to your dog. One problem that is faced by some Maltese dogs is obesity. The body of a Maltese is not made to support a lot of extra weight, so obese dogs can have problems with their joints. They may also develop digestive or metabolic disorders, heart disease, or back pain associated with the extra weight gain. Patent ductus arteriosus is a condition that these dogs have a genetic predisposition for. A vessel that carries blood between two different sections of the heart is not properly closed in dogs with this condition. With the vessel partly open, more blood is brought to the dog's lungs than it should be. This causes fluids to build up and can put extra stress on their heart. Maltese dogs may also develop a liver disorder called portosystemic shunt, PSS. This disorder caused some of the blood meant for the liver to go around it. With this reduced blood flow, the liver is not able to grow as it should and does not function properly. Livers in dogs with PSS are not able to remove toxins from the blood like a normally functioning liver would. In summary, here are some of the common health issues that Maltese dogs may face. Obesity, which can lead to joint problems, metabolic and digestive disorders, heart disease, or back pain, patent ductus arteriosus portosystemic shunt, PSS. These dogs have a very friendly personality. They are gentle and loving. A Maltese will be very happy to curl up on the lap of its owner. These traits will become much more reserved when the Maltese is around a person they do not know. In addition to the behaviors above, Maltese can also be very active. They enjoy running around and going for walks. They often seem to forget how small they are and will bark at or try to challenge another dog. Every dog is unique, and Maltese are no exception. Caring for these dogs will look different from caring for other breeds. Being informed about the health concerns, nutritional needs, and other unique aspects of this breed will allow you to keep your dog happy and healthy. Since Maltese dogs can have problems with obesity, it will be important to make sure you are feeding your dog the proper amount of food. For both adult and puppy dogs, you'll want to choose a high-quality food from a trusted manufacturer. Another option when feeding your dog is to offer home-prepared meals. Whichever option you choose, you'll want to consult with your veterinarian to make sure the food you are feeding your dog is meeting their nutritional needs. Every dog is different and may require a different quantity of food. Your dog's activity level, age, and other health concerns can impact the amount of food they should be eating. In general, adult dogs should eat somewhere between 1/4 and 3/4 cup of food each day. This food should be divided into 2 or 3 meals. When they are first born, the puppies can be free-fed. This means you can leave food out so they can eat when they want. By the time the puppy is about 12 weeks, you should stop free feeding them so they don't overeat. 12-week to 9-month-old puppies should eat 3 smaller meals each day. Once your dog is an adult, you can switch to feeding them 2 meals a day, or you may decide to stick to 3 meals. While a Maltese does not shed very much, they are still a pretty high-maintenance dog. To keep their coat looking nice and prevent it from getting tangled, you will need to brush your dog every day. It will also be important to bathe them regularly, condition their hair, and blow them dry. Their nails should be trimmed and their ears should be checked and cleaned regularly as well. In addition to the grooming items listed above, you will also want to brush your dog's teeth at least once a day. This will help protect them from developing dental disease. Training your Maltese dog will take a little bit of work. Over the years, they have learned ways to get what they want from their owners. However, if you start training your Maltese from an early age, are consistent, and use positive training methods, you should notice that your dog begins to comply with your requests. Maltese are very intelligent dogs, which means they are capable of learning more complex commands. They also make good show dogs and can excel in agility or obedience competitions. Maltese puppies will sleep between 18 and 20 hours each day. As they get a little older, the amount of sleep they need will decrease to between 12 and 14 hours. However, when they are awake, puppies will be very energetic. They can act hyper and may run all around your house. Puppies will begin to calm down around the age of 6 months and will be significantly calmer by the time they are between 9 and 12 months. Before you bring home a new Maltese puppy, you'll want to take a few steps to make sure your home is ready. Make sure you have purchased food, a harness and leash, a crate, toys, and all the other supplies you'll need for your new dog. You will also want to make sure your home is puppy-proofed. Remove any items that could be hazardous to the dog or that you wouldn't want to see destroyed by a puppy. Choosing a veterinarian before bringing home your new dog is also a good idea.